Probably the most common pelvic floor disorder relates to bladder dysfunction. And the majority of women who have bladder dysfunction actually have what is termed urinary incontinence, or basically, believe it or not, involuntary loss of urine. It's an extremely prevalent condition, and most women, unfortunately, don't realize how common it is. In the United States, we spend $4 billion a year on adult protective wear for bladder control problems in women. And some estimates say that 1/3 of all menstrual pads are actually used for bladder control. So that's a simple way to appreciate that most women just accept this. They put on a diaper or a pad for the problem. Unfortunately, they don't realize that this is a very treatable condition. When a woman starts to have a problem with bladder control, in general, it's due to one of two reasons. One is what we term stress incontinence, and that has nothing to do with emotional stress. That is the loss of urine that occurs when a woman's pressure inside her abdomen rises. For example, she coughs, she sneezes, she exercises, she lifts something up. In severe cases, it can even be walking. And the reason that occurs is the urethral tube, which is very, very short in a woman in contrast to being much longer in a man, the ability for that urethral tube to resist urine from coming out breaks down. And we don't know exactly why that occurs, but it occurs in many women as they experience childbirth, as they age in general. It's very, very fixable, and that's something that a woman really should not have to live with. The other big player in the bladder control arena is what we call an overactive bladder. Totally different problem. The bladder is nothing more than a muscle, and when that muscle starts to become involuntary, it should normally be voluntary, meaning a woman should be able to perceive that her bladder is filling up. When she gets the urge to go, she should be able to comfortably get to the toilet, sit down, voluntarily stimulate that bladder muscle to contract, and urinate normally. Unfortunately, for again, reasons we don't fully understand, that bladder can become involuntary. So now a woman gets the perception or the urge to go. She may be at the mall. She doesn't have the ability to resist that bladder from contracting until she gets to the toilet. So it starts to contract before she can get to the toilet, and she has the sort of when I gotta go loss of urine. I can't make it to the bathroom. The key in the door phenomena. And that's what we call an overactive bladder. Those are the two big players that basically encompass 95 to 97% of all bladder control issues. In addition to a bladder control problem, other common conditions that we deal with as urogynecologists include things like recurrent bladder infections. Some women, for reasons we don't fully understand, all of a sudden out of the blue will start to have infections on a regular basis. Other problems may include difficulty evacuating your bladder, actually going to the bathroom, in that you feel like you never empty or that you have to struggle at getting your urine out. And then finally, one of the most devastating things a woman can develop is an actual painful bladder, something that's been termed interstitial cystitis in the past. And again, over time we've started to understand this devastating condition, and usually we can provide some significant relief to those women as well. When we get to treatment, we'll start with bladder control problems. Again, the involuntary loss of urine, as I stated, is due to one of two conditions the majority of time, or a combination of the two. Extremely important to get the right diagnosis. Once you have that diagnosis, the treatment may include things as simple as behavioral modification, rehabilitating a woman's pelvic floor muscles, possibly a medicine, sometimes a minimally invasive surgery. There's a lot of inappropriate perceptions about surgery in this area. And I can just tell you that the surgeries that we do are extremely safe and extremely efficacious, and 95% of the time they're done as an outpatient with very, very little downtime. It all starts by a woman realizing that she has a problem and coming in for a consultation. With that consultation, We go to great lengths to appreciate the impact of the problem on our quality of life and then initiate a therapy that is specific and appropriate for that specific condition and that specific patient.